Good day, everyone. Today, we will talk about a topic that includes restless work and unpaid labor. That can be a difficult task for you, me, or anyone, but it is a sacrifice worth giving. Home care nursing is a job primarily for family members to take care of a patient, usually a sick family member. It is important to discuss this because it is inevitable and can happen in every household, and without proper knowledge, the worst may come of it. Before I will discuss further, let's watch this video.
Hey, Dal.
Hello.
Oh, Crocs, babe. How long's it been like that for?
I don't know.
Do you know what hazard that child was at risk of in the example I shown? The example shown was a physical hazard, specifically an electrical hazard. Other physical hazards include tripping hazards like wet floors and noise hazards such as loudspeakers. To prevent these from happening, make sure you look out for damaged wires and fix them as soon as possible. Check for spills and wet areas and check for any possible noise pollutants. Aside from physical hazards, there are other kinds, such as biological hazards. It includes bacteria and viruses and contaminated waste, such as feces, blood, and other bodily fluids. To prevent this hazard, clean every surface of the patient's room every 3 to 4 days. Ergonomical hazards, the least common hazard you will encounter. It is caused by physical strain, like carrying heavy loads, too much bending and reaching, standing for a long period of time, and awkward movements. To prevent this, make sure your patient isn't doing any strenuous activities. Chemical hazards. This consists of cleaning products, especially liquid variety, and disinfecting solutions. To prevent this type of hazard from possibly harming your patient, make sure after you're done cleaning their room, you immediately take the cleaning solutions somewhere else outside of the patient's vicinity. The last type of hazards are psychological hazards. This type of hazard occurs within the home nurse most of the time. It includes burnout, verbal abuse from patients, and unreasonable expectations. To prevent this, don't take their verbal abuse seriously. The patients are just tired and emotionally unstable. Checking for any risks or hazards is key in helping your patients live. It's our job to protect and nurse them back to health. When finding risks, remove them immediately. If not, many unfortunate events may take place. This is why we need to look out for these types of hazards. Talking about risks and hazards, there are more things to look out for as a home nurse. One of them is knowing about different types of diseases. Do you know what illness is shown in this picture? Assessing from what it looks like, she has a common cold. A common cold is a viral infection through your nose and throat. Its symptoms include a runny nose, cough, sore throat, sneezing, and low fever. To treat it, let the patient drink extra fluid, like water or fruit juice if tolerable. It is also a communicable disease, which is one of the 2 types of diseases. A communicable disease is an infection that can spread through a living organism or the environment. They are transmitted through direct contact, like touching of an infected individual's hand, legs, etc. Indirect contact, on the other hand, happens when a sickly individual touches an item, and that item becomes a carrier of the patient's disease. And airborne transmission, which is spread through the air as microscopic particles. To avoid this type of disease, wash your hands before and after tasks that require physical use. Eat a balanced meal, and avoid sharing utensils. Now let us discuss the other communicable diseases. Chickenpox, a viral infection that causes fever and itchy rashes all around the body. Symptoms include its infamous pinkish red spots that turn into blisters, itchiness, and fever. To prevent this, cut the nails of the patient to be short to prevent infection by scratching. Measles, an infection that causes a red blotchy rash that appears on the face, which eventually spreads downward to the chest and then the feet. It also includes low fever that increases in temperature every day, loss of appetite, and sore mouth. To cure this disease, drink extra fluids like water and rinse the mouth of the patient often. Mumps. It is characterized with puffy cheeks and swollen jaw, brought by the effect of swollen salivary glands under the ears. It causes pain in swallowing and chewing, and causes fever. To cure this illness, let the patient rest, put a cold compress on the swollen cheek, and give the patient a liquid to soft diet. Let's proceed to non-communicable diseases. Non-communicable diseases are the result of malfunctioning organs, faulty habits, and accidents. It is also not infectious. This type of disease is caused by many factors, primarily an unhealthy diet, cigarette usage, physical inactivity, obesity, genetics, harmful use of alcohol, and environmental causes. To prevent this, live a healthy lifestyle. Don't eat junk food often, be physically active, and don't drink alcohol. So that's all. Hopefully you learned something from this. Thank you and goodbye.